When it comes health worker, it's most of them are Filipino. It's like a heritage.
We always taking care of people as much as we can.
In California, Filipinos make up almost 18% of the state's nursing workforce. Among them is Narissa, a nurse in Pasadena.
It's hard to work if you're not in your own country. But we need to be here for our family, for the people that need our help. I was born and raised in the Philippines, and I was a nurse. I've been working here in Pasadena for more than 6 years. I work most of the time is 7 days a week.
Sometimes I work 24 hours.
Once I get up and be out of my house and go to work, the first thing I'm doing is pray. That's the only sword or shields that, even if I have mask, to wash my hands, social distancing, but no matter what, at the end of the day,
My faith. And every day I don't have nobody, aside from pray. How do you call it? This is my headquarters. Especially when I'm too exhausted, no matter what, I need to go to my headquarters and have some coffee for a while just to have air.
I started to work at 7 a.m. I get off usually at 9, but after I get off at 9, I'm on call for a hospice patient if they need some, care or help. It's a lot, there's cancer, there's a dementia, there's Alzheimer. Their health condition is declining. Most of my patients aging like 60 years old to 100. It's more scary. Now, every day, we don't know what's gonna happen, how many patients that it's gonna be, expired in my hand, and how many patients I need to work with. But no matter what, I need to be here for them.
Nearly 1/3 of the nurses who've died of COVID-19 in the US are Filipino, even though Filipino nurses make up just 4% of the nursing population nationwide. Experts say one factor could be that Philippine-trained nurses are disproportionately in the ICUs, the emergency rooms, and long-term care facilities, such as nursing homes, compared to white US-trained nurses. Therefore, they are much more exposed to COVID-19.
This is only my relaxed time that I can bend and breathe a little bit. I have my, tears. I can't help it because, finally, for how many months, almost a year, we have this vaccine. Hi. Do we have the chai tea latte first? Do we have the chai tea?
We have chai tea.
Okay.
For all of us, this pandemic, it's hard. I have chronic asthma and my family too, so I don't want to bring any of that to my family, but I need to help people as much as I can.
How do you call it?
Stopper?
Yeah, stopper. Thank you. Oh, there's no one in here. Most of my coworkers, they quit because we have some outbreak last week, so they're afraid because of the outbreak. But rather than that, most of them are sick also, so that's why I need to cover the shift. I have a lot of friends. They're afraid to say something because to the fact that they need to stay safe, but they still need a job. So what I did is, if I have some extra, like gloves, like PPE gown, if I can share it, I can share it. I have a lot of friends also that they're undocumented. They're working right now. They're the one who in frontliners, but they're afraid to speak. They're afraid to speak, but they're still here. They're still here, and they're not doing nothing wrong. They're not hurting people. They're loving people. They're taking care of people.
They're still working, and they're still surviving, and they still have, we're just keep in touch every day.
It's being emotional to me when I'm telling them We love our country, and we love us being Filipino.